new unpublished study by the South African Medical Research Council has revealed weekly trauma unit admissions fell by 60% since the start of the COVID-19 lockdown and alcohol ban in March. A senior journalist from the Bhekisisa Centre for Health Journalism, Joan van Dijk, joins us to discuss further in terms of the effects of alcohol abuse also in this country. Perhaps, Joan, let's start here. What is the true cost of alcohol abuse in South Africa, especially in relation to deaths and the burden on our healthcare system?
The cost to our system can be, it's quite devastating. About 171 people die of alcohol-related causes every day in the country, and that relates to about 260 billion rand cost to the economy as well. To give you an idea of just how big that number is, that's just a little bit more than our health budget for the whole financial year. And what that does to our health system is that, for example, when we had the alcohol ban during stages 4 and 5, we had 10,000 more beds available in hospitals because of a huge drop in alcohol-related cases showing up at hospitals. And the reason those beds are important is because we know from mathematical modeling that we are very likely to run out of beds for coronavirus patients. And now that some of the regulations have come back, the medical research study data shows us that 5,000 of those empty beds will be filled again with alcohol cases.
This is not a pretty picture by any stretch of the imagination. What sort of interventions have we seen, if any, on the part of government?
The government has tried and failed for 10 years to put in stricter liquor laws for South Africa. In 2010, they set up a specialist team that comprised of 11 different government departments, and their job was to put together a whole list of alcohol regulations that could really work towards getting down that harmful alcohol use and some of those scary numbers we were talking about. For example, one of the things they came up with was the 2013 Control of Alcohol Marketing Bill, and that would ban alcohol advertising completely, except in shops where it's sold, and also sponsorships. Another one was the Liquor Products Amendment Bill, which would push up the legal drinking age to 21. All those regulations are just stuck. And as a result, the harmful alcohol use in South Africa has continued over the last 10 years. And that hasn't given the government a very good framework to work with now when those harmful cases are showing up in hospitals and we need them for coronavirus patients.
I'm curious to find out why the bills got stuck. With the Control of Marketing of Alcohol Beverages Bill of 2013 that you mentioned, it took them almost a decade to put together. So why are they stuck?
Health activists are kind of confused about what happened to those and why it got stuck. They say it could be lobbying by the industries that are involved that would be affected by this bill, and also it could be disagreements within government. But around the time of that bill was in the media a lot, there was a lot of lobbying from the alcohol industry, for example, but other industries as well. But nonetheless, regardless of that lobbying, this bill had full government backing. The government even decided in 2010 to stop taking alcohol money through sponsors and partnerships, although many departments have still broken that rule. What we do know from a letter from former Health Minister Motsoaledi, that the Health Department might have been waiting for the Liquor Amendment Bill to go through, and that's one that will change the drinking age to 21. But that piece of legislation has gotten stuck as well.
I guess we just need to do a little bit more digging as to why, but when we talk about the advertising of alcohol in general, is it all that bad?
There's been study after study showing that the more liquor ads young people see, the more likely they are to start drinking younger and to binge drink. There was also a study from Gauteng and the Western Cape that found a link between liquor adverts and community drinking, as well as intimate partner violence in communities, and that's why we would need kind of stricter laws. At the moment, the industry self-regulates, and it's got a long list of rules that it plays by when it comes to alcohol advertising. But most public health activists and experts say that this is not enough. and that even branded social campaigns. I'm sure you might have seen some of the campaigns running that, you know, alcohol isn't, there's no excuse for abuse, those kind of campaigns that are linked to an alcohol brand, that actually doubles as advertising for the industry as well. So many public health experts are now advocating for stricter rules around that kind of sponsorship as well.
Joan, you've done a really great job with this article, and for our viewers who are interested in picking it up further, you can visit the Bhekisisa website to read up more on what she wrote there. Joan van Dyk is from the Bhekisisa Centre for Health Journalism. She's a senior journalist there.